Hi there, I hope you're doing well. My name is Pamiti and welcome to my channel. Well, on this channel we discuss a whole lot of things, but at the moment we are going to be talking about the NHI bill that was signed into law yesterday.
I'm signing here. I hereby, in terms of section 84.2, read with section 79.1 of the Constitution of the Republic of South Africa 1996, assent to the National Health Insurance Act of 2023, Act number 20, and sign the English text thereof, given under my hand at Pretoria on this day, 2024. So I sign where it's written President.
Now, a couple of people are not sure exactly what this bill means and what this bill entails. We just know that there's a lot of uncertainty. Some people are happy, some people are not so happy. And in this video, I'm going to try and clarify as much as I possibly can. Obviously, I'm not an expert at this topic. So if you are, or you feel like there's something that I've left out which could be important, please let me know in the comment section below so that I can clarify it probably in another video, or perhaps another person could read your comment and learn a bit more than I have given in this video. All right. So what exactly is the NHI? What does it mean? What does it stand for? So NHI stands for the National Health Insurance, right? So National Health Insurance being, for example, if I were just to break it down to you, just to clarify it a bit more. Let's say we had a big pot. In this big pot itself is called the National Health Insurance. Now it's an insurance fund, a health insurance fund. And we're going to have contributions that put monies into the insurance pot that we have, into this national health insurance pot. So the contributions are going to come from employees and employers. So I think most probably there's going to be a certain percentage that's taken from employers and a certain percentage that's taken from the employees. Now, I think there's still a couple of logistics and a couple of meetings that will still need to be held just to clarify exactly how this insurance is going to be run. So with all those contributions that are going to be put into this big pot, which is our national health insurance, whenever a South African or whenever a citizen within South Africa needs to get some medical attention or needs some medical visitation, anything medical related, anything that will need you to go to a clinic, anything that will need you to go to a hospital, state owned. Remember, we still have our private medical cares. So we still have our private hospitals. We still have our private clinics. So this health insurance fund, because it's state owned, it will exclude the private sector. So I think that's one portion that we have to keep in mind. We will still have our private sector when it comes to healthcare, but this insurance in particular, remember, it's going to be sort of like state owned, because like tax, like the normal income tax that we have that goes off our pay slips every month, we know that that tax goes into mostly the running of South Africa, be it our road constructions, be it our parks, be it just maintenance of South Africa as a whole. That's what our income tax goes towards, you know? So this is going to be a different type of tax because it's going to go into our health system, into this pot that we're talking about. So when all these contributions are made into this pot, the day that you need medical assistance, you go to your clinic, you go to your hospital, and then funds are going to be taken from that pot to pay for that medical visit that you went to the hospital or clinic for. I hope that makes sense. I hope I'm breaking it down in the clearest way that everyone can understand. The aim of this is to equalize medical health care for everyone within South Africa. So when you go to a state clinic, when you go to a state hospital, everyone is just like the healthcare, the treatment that you get is just standard. So it's the same for everybody. So there isn't this sort of like special treatment for this type of people, it's just meant to equalize the health system for everyone. You understand what I'm saying? When it comes to the national health insurance, this big pot and the funds that are in there, they are going to have some, ailments, illnesses, surgeries, treatments, whatever, that are on the list for all the state hospitals, state clinics. So that is like, okay, this money that we have in our national health insurance pot, it is going to cover this illness, that ailment, this surgery, it's going to have, and then some of the things that are not covered there can still be covered by your medical aid. But now remember, when it comes to the private sector treatments and all are not going to get any funds from this national health insurance. So the national health insurance is only assisting state-related entities, the clinics, the state hospitals. So when it comes to the private sector, those are not getting any funds from this national health insurance. So if people still want to stick with their medical aids, this is now going to be an extra expense, because as long as you're working, chances are that health insurance is still going to be deducted. So now you're going to have your medical aid deducting money from you, and then you're still going to have this national health insurance also deducting money from you, because chances are this is going to be made compulsory for all South African citizens, or for all people working in South Africa. Now, we do know that we also do have people from outside that work and that are legally in South Africa. They do also pay some form of tax, and also this is something that is open to them. So if I say South Africans, please, in this case, I'm going to be including them as well. All right, coolio. So in this list, all these ailments that are going to be attended to in our state-owned hospitals and clinics, there's going to be that list that I told you about all the ailments that, and then probably if you want to do something surgery-wise, which is not on that government list, then you can go to your private hospital to get that done. And that's going to be at your own expense. And that can now probably be covered by your medical aid. But we must remember that medical aid also still has its own terms and conditions. It still has its own things that it covers according to the policy or the plan that you've taken, the medical plan, the medical aid plan that you've taken. So all those things will come into account. Now, when it comes to this National Health Insurance Act that was signed yesterday, there's still a couple of things that still need to be dusted out, that need to be clarified. Of course, this has been an ongoing topic. It's not something that was just discussed 2 weeks ago and signed yesterday. But now the trick about it is that people are feeling like it was a bit of a rushed decision. Signing of the act was a bit rushed by President Cyril Ramaphosa. We know what in 2 weeks' time, South Africans are going to the polls. We're going to be voting. That's on the 29th of May. We should all be going to vote. And I think it left a couple of people a bit confused that why the rush to sign, especially 2 weeks before we go into voting, because anything can happen at the polls. All right, I think the ANC does have the confidence that, you know what, we're still going to push on. We're still going to be doing this for another couple of years and all. But the honest truth is that absolutely anything can happen at the polls. And, signing something so heavy, I'm going to call it heavy at the moment, just 2 weeks before we go to the poll, I think it has caused people to raise their eyebrows. Uguti, what exactly are we rushing for? Or what are you hoping? Is it perhaps maybe a plan? Because in all honesty, this insurance fund, it benefits non-working South Africans the most. We know that in South Africa, we have a very large population of people that are not working, that are not employed. Now, if this health insurance is leveling that, whether you are working, whether you are not working, but when it comes to healthcare, you're all going to be treated exactly the same. I think it would be something that benefits more the unemployed South African than it does to the employed South African. Because now this tax, remember, it's coming from the employed South African. Because as an unemployed person, you can't possibly be expected to pay for something if you don't have money. So you see, so basically, I think where this needed to be perhaps discussed a bit further, and where this needed to, some sit downs, some negotiations, and I understand those things have been done, but I think there's still that bit of unease because it was signed before everyone had adjusted to the idea to. It just seemed a bit rushed. If you follow everything that happened that led to yesterday's signing, doctors are not happy. Doctors are threatening to leave South Africa. Some political parties, let me give you an instance, the DA.
We always understood that the NHI was destined to be used as a cheap stunt by an increasingly desperate and populist ANC. Having the foresight to understand that the ANC is so depraved that it wouldn't hesitate to put people's lives at risk as an election gimmick, has enabled the DA to quietly prepare for this moment in the background. And that is why I'm now in a position to make the following announcement. The Democratic Alliance will, upon its signing into law by Cyril Ramaphosa, challenge the ANC's NHI all the way to the Constitutional Court. Our legal team was briefed months ago already and will file our legal challenge against this devastating legislation without delay. We have built up reams of correspondence, including with Ramaphosa himself, that we will enter into evidence to show that the process which led to the adoption of this bill by Parliament disregarded public input, and that the bill itself is flagrantly unconstitutional. But we will not stop there, because our furthermore pledge today before the nation that if this country elects the DA into national government on the 29th of May, we will immediately repeal the NHI bill and prevent it from destroying this country. Because this is no ordinary piece of legislation. It is more comprehensive in scope, more corrupt in intent, and more deadly in impact than BEE, load shedding, cadre deployment, land expropriation, and nationalization put together.
Now, the DA isn't the only political party that's dissatisfied about the signing of this bill. But for now, I think let me leave it there. There's a lot of elements that have been highlighted when it comes to this NHI, including, as the DA agent said, the corruption part of it, because we know where there are funds involved, then there are usually stories that are also involved. And at the end of the day, anything with funds is possibly going to have some negative reports at the end of it. And besides that, in my own view, if like a simpleton like me had an opinion in this whole thing, I think the way that our state hospitals and our state clinics are run at the moment, they are not run smoothly. Yes, South Africa does have a great health system, but the way the system runs, there's still a lot of cleaning up that could happen to our national healthcare facilities, to our clinics, to our hospitals. They still need a hell of a lot of attention to the smooth running, to the revamping of the facilities themselves. I mean, there's so much that could have been done in the healthcare system rather than going for this national health insurance. I think possibly if it was going to be done, this is not really the right time to have done it, because there's still so much to fix before we could probably get to the level of signing this act. That's my own personal view. Give me your own opinion. Give me your own comments on this health act that has been signed. I'd like to hear from you as well. Thanks, Danas. Take care.